Hello and a warm welcome on day 3 of the international webinar series on risk communication and community engagement responses to COVID-19, organized by Department of Mass Communication and Journalism, Tekpur University, in collaboration with UNICEF Assam. Sincere gratitude to each one of you for your enthusiastic participation during the first 2 days of the webinar and joining us again today. After 3 amazing sessions by Professor David Mould, Professor Jan Service and Professor B.P. Sanjay, today again we are delighted to have with us 3 more eminent guest speakers. Dr. Paulo, Country Representative, UNICEF Chile, Professor Claudia Lago, Professor in the Department of Communication and Arts, University of Sao Paulo, Brazil, and Professor Basu, Professor in the Department of Journalism and Mass Communication, Banaras Hindu University, India. Hearty welcome to Dr. Mephalopoulos, Professor Lago, and Professor Basu. Our association with Professor Basu goes a long way. He has been a member of the Board of Studies of our department and part of many academic endeavors that we have undertaken over the years. He has also been part of the syllabus drafting committee of the one-of-its-kind MA Communication for Development program that our department launched in 2016. Thank you, sir, for joining us again today. This may be the first time that we are connecting directly with Dr. Mephalopoulos, but we do have a long-standing association with him too. In fact, through his books on development communication and participatory communication, which are very important readings for us. And I must admit that my personal copy of the participatory communication books that is written, the Development Communication Source book, it is in fact a very heavily underlined one. So I must also mention that the MA-C4D program that we launched in 2016 was actually under his patronage. At that time, he was serving as the chief of C4D UNICEF India, and it was under his guidance that everything happened. So we are really grateful and delighted to have you with us today. Professor Claudia Lago is someone with whom we have come in touch with very recently, thanks to a mutual friend, Dr. Umashankar Pandey. But then we are already very touched by her warmth. So we hope this is only the beginning of a very long and meaningful association that we will have into the future with Professor Lago. Thank you so much for joining us today. We also have with us Ms. Veena Singh, C4D Specialist, UNICEF West Bengal Field Office, who will be moderating our session today. Before I go on to give a formal introduction regarding Veena, I would like to share that although our relationship with Veena started as a professional one, for our department, she is now like a family member. So it was Veena again who actually facilitated the process of launching the MSc40 program in our department during her stint as communication specialist with UNICEF Assam office during that time. And I believe now, even now when she is with UNICEF West Bengal, she has already started taking similar initiatives at her workplace there. So now to formally introduce Veena. Veena has 12 years of well-rounded experience in communication domain with program focus in developing countries, India, Gambia, West Africa. She has worked in various states of India such as Bihar, Uttar Pradesh and Assam, including all states in northeast of India and West Bengal, covering diverse situations including disaster situations. She has specialized expertise in applications of C4D within thematic areas, along with proven experience in C4D capacity development, system strengthening and institutional integration of C4D, development and delivery of training programs and C4D curriculum development. In addition to English, she is also well-versed with another foreign language, Spanish. Before I hand over to Veena, May I take the opportunity to quickly brief our speakers and participants today about the sessions that we had yesterday. I will not take very long. The first lecture yesterday was by Professor Yang Service. In his lecture titled The Missing 18th SDG, Communication for All in the Age of COVID-19, Professor Service emphasized that today it is more necessary to ensure communication for all was a few decades ago when discussions about MDGs had just started. He premised the lecture around four main points: the transition from MDGs to SDGs, the role in place of communication and culture, the need for introducing a new SDG which will ensure communication for all and digital inclusion, a communication framework to tackle pandemics. He highlighted the challenge being faced by the UN's sustainable development, a major one being able to understand the place and role of communication and culture. Professor Service then introduced the 11-point communication framework that can facilitate and ensure communication for all. The second lecture was by Professor B.P. Sanjay, titled Paradigm Continuity and SDGs. In his lecture, Professor Sanjay pointed out that there have been constant inclinations to define the paradigm of development, particularly through the framework of media. In the advocacy phase of media, he said several dimensions of modernization and development were brought into fore to talk about the need for media and the classical notion of its role as a magic multiplier. But unfortunately, media centrality have failed to bring about the desired change. The hope that media will automatically facilitate development did not materialize, and the potential intersection between media and development has not yet taken place. He contended that in order to achieve desired results in terms of SDGs, more contextualized communication strategies and customized media partnerships are required. The answer is not in the mere presence of media or advocacy through a centralized media system. So this was in very brief about our sessions yesterday. So I would now like to hand over to Veena, who would introduce our speakers for today and take forward the next sessions. Thank you. Over to you, Veena.
Good evening, Anjuman, and all the participants who have joined us today, along with all the speakers from across the globe. Thank you for that generous introduction also. To me also, Mass Communication Department of Tezpur University is everybody. So I would like to begin by stating the importance of communities, since today's session is completely revolving around communication with communities in the environment of health emergency. So I would like to start by saying that any outbreak begins with one person falling sick in a community, and it ends with that sick person getting well. So that pretty much sums up the importance of taking communities along when we are doing communication. Also, I'm sure all of you will agree with me when I say that this pandemic has affected each one of us directly and indirectly. And recently, myself and my entire family was tested COVID positive. And while being in quarantine, I had written a couple of lines which also stay with me till now, because we are living in a context of uncertainty. So just taking the liberty of reciting those lines to all of you. I wrote that home is comforting, warm and serene, not the kind who would crib about being in quarantine. Days were supposed to be 14, but as I face it firsthand, they're updated to 17, and such are the idiosyncrasies of novel coronavirus COVID-19. So what I want to say through these lines is that as communicators also, one thing that this pandemic has really told us and compelled us to believe that we need to learn to communicate uncertainties. We cannot be always certain when we are disseminating information. Also, since today's topic is RCCE, I would briefly touch upon what is risk communication and community engagement. So it is a real-time exchange of information, advice, and opinions between experts and people who face threat to their health and social well-being. The ultimate purpose of risk communication and community engagement is that everyone who is at risk is able to take informed decisions to mitigate the effects of the threat, such as the disease, or and take preventive action and preventive measures. Now, as we are talking about the COVID-19 virus, we have seen that the virus has effectively started communicating with the way human beings think and carry on with their lives. And I'm sure you all, if you introspect, would realize that, because one day I was thinking that it has actually started talking to us and interfering in our lives to the extent that it has challenged the basic human behavior. We as human beings like to be together, but it has actually created a situation where we have to maintain physical distance. We as human beings like to, whenever we feel a little down, going out makes us feel better. But it has actually challenged us at that level where we have to keep ourselves confined to our houses. So such is the magnanimity of this little virus, and it also tells us a lot about how we need to adapt to the evolving situations that come in front of us in our lives. Now, as much as it has affected our lives, it has also affected us as communication practitioners, wherein the basic spirit of doing community engagement has been challenged. In doing any community engagement activity, we need to be in a group. We need to be collectively discussing things, dialoguing. But it has also challenged that. And now we have to think of those kind of activities which can be done keeping in mind the COVID appropriate behaviors. And in that particularly, the aspect of maintaining physical distancing. So earlier, all the traditional ways of communicating with communities, such as organizing group meetings or doing interpersonal communication, that has taken a back seat and has been replaced by communication through digital media or many other topical ways of reaching out to people. For example, I would like to talk about what we have been doing in West Bengal. We have been using this concept of audio and number of families at a time, but without getting in direct contact with them. It has its own disadvantages, but was the best and the most topical way to communicate with them in the given situation of the pandemic. So now this was a little bit from West Bengal. We all know that we are very excited to hear the experiences of so many experts who are with us from across the globe. So I won't take much time, and I would directly move on to the format of today's session. So the session is planned in a way that each speaker will get 25 minutes to present, and the first speaker, Dr. Paulo, since he has to leave for an
Veena, you have been muted. You'll have to unmute yourself.
I'm sorry, I don't know where did I lose? What was the last thing that you heard me say?
You were talking about Paulo. You were introducing.
Okay. Yeah. So I was saying that I was introducing the format of today's session. So Dr. Paulo is our first speaker, and since he has to go for a meeting, we would be taking the questions for his session as soon as he completes his presentation, and thereafter we will be taking questions in the end after the rest of the two speakers have completed their presentation. So that is how we will move forward. With that, let me formally invite Paulo. So before the formal introduction to Dr. Paulo, I would like to cite that he has been my first boss when I joined UNICEF as a very, very young professional at the age of, I would say, 25, and he has that ability of making the entire team as one family. So that was one thing which has touched me, and one takeaway as an experience. Of course, there are so many other technical things that I learned from him, but as a leader, that was one thing that really touched me. So, Dr. Paulo, as we all know, is presently the country representative of UNICEF Chile, and he holds a doctorate degree in communication from the University of Texas at Austin. He started his professional career in the world of media production, working in public and private television network organizations and international organizations such as UNESCO, FAO, CISP, European Union, World Bank, and of course UNICEF across the world. Of course, he has so many books to his credit, which Anjuman has already mentioned about. While working for FAO, Dr. Paulo was part of a team that developed an innovative methodology known as Participatory Rural Communication Appraisal, adopted by many projects around the world. He is the author of Participatory Communication, a practical guide and development communication source book. He has vast experience as facilitator of adult courses in communication for development, as well as in experiential courses to strengthen planning and strategy development. This is just a very small part of what Dr. Paulo is, and now we are going to hear more from him. So pretty excited. Over to you, Paulo.
Thank you, Ina, and I hope you can hear me well. Well, first of all, let me say hi to everybody there, to panelists and participants, and thank you for you. I always say that I got my academic PhD in Texas, but my life PhD in India. I mean, 5 years there has been an incredible learning experience. And actually, I remember starting the idea of an academic platform to be used by universities, and it's very nice to see that this is rolling on and going on. So, coming to today's topic, I would like just to start saying, reflecting how this year has deeply changed much of our life's routine and habit. Less than a year ago, we were living in a very different world. You might even not remember how different it was, but much of what we took for granted has changed in a rather sudden way. Taking a bus, taking a plane, traveling, dining out, hugging each other, even shaking hands. Actually, here in Chile, I have now introduced the Indian way of greetings, which is COVID say. So I don't say namaste, but everything else I do it. And we are all aware that from a medical point of view, the biggest risk actually are for the elderly populations and people with previous conditions. However, the one most affected by this pandemic in the physical and emotional development are the children. Again, not so much in terms of consequences from catching the virus, but due to the many implications. Globally, over 1.6 billion children are out of school, and they've been affected by the closure of schools in 192 countries. These consequences of this pandemic, and I don't know if Dina, can you put the PowerPoint, please? The consequences are showing in many different and unexpected ways. We know that obesity, for instance, increases the risk of those contracting the virus, but at the same time, we know that one of the major consequences of the lockdown is actually obesity in children and in other segments of the population. The lockdown also affects the emotional development and socialization skills of children, especially of the younger ones. And nobody knows for sure what will be the long-term effects of this situation on children's life once the pandemic will be over. Available evidence in Chile and in other countries shows that obesity and mental issues in children have increased sharply during the pandemic, and the education inequality gap has also further widened, with children from the vulnerable segments of society not having been able to take equal advantage from distance learning due to a number of factors and causes, from poor connectivity, not having tablets or computers, insufficient teachers training to adapt and adopt the online curriculum. We also know from past evidence from the Zika, SARS, Ebola outbreaks that usually in this situation there is a sharp increase in gender, and the same we expect unfortunately to occur with the COVID-19, even if reliable data are difficult still to obtain. So what can be done to improve the situation and mitigate the risk, and who can be involved in the efforts to mitigate this risk for children? Let us start from highlighting what has shown not to be particularly effective, and that is information campaigns. It's the easiest things to do, and yet it's the one that usually doesn't work that much. Especially now, where all over the world we're seeing how the distinction between facts and fictions has blurred. The distrust on traditional messengers and messages is so spread out that fake news are considered real for large segments of the population. It is not the evidence-based rigor of science or the reporting based on verifiable sources that makes many people believe if certain information is true. It is the ideological framework that persons hold that make them discriminate what is true and what is not. And I wonder how different is this from the information propaganda machinery of dictatorship of the past. The pandemic negative effects on children are affecting many of the sustainable development goals. But I would say that they could all in certain way be contained in one, SDG 10, reduced inequalities. And this applies both to inequalities within a country and among countries. Recent studies have highlighted the pandemic as severely affected achievements we were making against extreme poverty. We are expected to go back to rates of poverty we had 50 years ago worldwide. So all the advance we made this year, they might be wiped out and we might go back dramatically. Entire groups of population will fall into poverty, while others will see the standard of living falling sharply. And some, the most vulnerable, will be most affected. And children are the ones most affected within the vulnerable segments by the burden of this situation. There is no magic formula or one-size-fits-all recipe to mitigate the effects of this situation. And every country has a different socioeconomic situation and different capacity. However, I would like to highlight a general planning blueprint that could serve as a guideline in helping identifying, addressing, and mitigating the most pressing challenges for children, which are multidimensional. And Vina, if you can put the next slide. It is actually a model I've been working on, and I started thinking about when I was in India, where we actually worked a lot on the social ecological model. And this is a bit an adaptation of that. This intends to, it is composed by 3 dimensions, of which are the context, which are needed to create a conducive environment where change will happen at the individual level, which is where the sort of behavior change communication is actually more focused. The dimension defining the social economical environment then are the public policy dimension that we see up, which addresses policy and budget needed to address the change. The organizational dimension, where public and state institutions, civil society organization, church organization, private sectors, academic centers and foundations can actually help and have a mandate and capacity to promote the change. And the third is a socio-cultural dimension that deals with existing norms, with media that can shape those norms, and other people-based networks. And this is where community engagement is key. Let me now try to link some of the key action required to mitigate the impact on the pandemic on children. The public policy dimension, for instance, would need to focus on measures by the state to actually help these segments. And since the economic one, it's one of the most serious negative effects, the state must plan and help with definite measures. So far, in Chile, like in many other Latin America and I think worldwide countries, for instance, there has been made some emergency cash transfers. There were policy and regulations made for the deferral of due payments for rent or mortgages, to provide food baskets to poorer families, safety nets for workers losing their jobs, and other issues, especially because the decrease that imposed lockdown and quarantine made a lot of people lose their livelihoods. In the organizational dimension, school closings are the ones that are affecting children in many ways, well beyond the instructional factor. Children in poorer households have been affected because of, as we said, lack of connectivity or overcrowding, and staying at home has also affected children in many other ways. The schools are also a place where to socialize and have emotional skills developed. They also serve as early warning system in case of domestic violence, something that cannot be monitored effectively when everybody is constrained in the limited space of the same household. In many countries, public schools also serve the main meal for many children who come from vulnerable households and emotional, and have an emotional impact. I remember, here in Chile we have a program for the main meal, but I know in India you have it too. I still remember once going with some of my staff in, I think it was in Bihar, in one of the schools, and sitting with the children to have them to share the meals. They invited me there. Incredible experience, and I was amazed also how spicy it was, despite it was 8-9 years children, and I really suffered. And the children seems to have a very good time to see me becoming all red. But the food impact is another one in vulnerable segments. The third dimension refers to social cultural norms that can facilitate or impede change. In Latin America, for instance, we have hugging, kissing, shaking hands, and all this had to suddenly stop. Grandparents cannot hold their nephews, and in some cases cannot even see them directly. Keeping physical distance due to the virus meant changing norms and habits that we hold for hundreds of years. And the adoption of new norms and rules would have been expected to be held by media, relevant networks, and influencers, even though it's not always been the case. This is where community engagement must play a big role. And we know, and Vina knows it very well as well, that to support change, the best way is not vertical communication, it is dialogical communication, engaging in dialogue, participation, and engage different groups of people. Unfortunately, all this has been made more difficult by the spreading of fake news and the complex media landscape, social media especially, that we're living. And this three dimension briefly highlighted what is needed to be in place for then going and trying to apply and work on the individual dimension, where we provide knowledge, engaging dialogue, working on the attitudes, but we know that to be sustainable, such change cannot be imposed or just achieved through dissemination of information, but must be fully understood, discussed, and accepted by individuals. And this is why participatory communication becomes key. COVID-19 is affecting all the countries of the world and the people of the world, but it is not affecting people in a similar way. It is affecting people in a disproportionate, unequal way. And the ones paying a higher price are those at the bottom of society. And within those most affected, children are always the ones paying the highest price. As the effects of the pandemic is not affecting just their present situation, but also their future. And if you can put the next slide, please, and the last. That's why I always focus a lot. And when I go and present SDGs, I always say the heart to me of all SDG is this one, is reducing inequalities. Because if we reduce inequalities, everything else will be improved. How can we do this? Of course, communication alone is not enough, yet it is necessary. And I have identified here the three strategic lines. The first one is about advocacy with policy and decision makers in order to pass and implement specific measures and interventions aimed at mitigating the negative effects of COVID-19 repercussion on children and guarantee that their rights from education to safety from violence, from health to play, and more will be guaranteed. The second is communication. I put monological and dialogical. You can call it one-way and two-way communication. Strategies to address actions with selected audiences aimed at improving children's lives and protect their rights. So here you can address public opinion in general, but also you need to address specific audiences. Can be teachers, can be mother-in-laws, extensionists, health promoter, depending from what you want, but having an engagement with them about what needs to be done to mitigate and make sure that these inequalities do not get bigger. And the third, which is also usually very much neglected, and we are working hard here in Chile, it's what I call the empowerment communication to engage children in decision-making processes affecting their lives. By empowerment communication, I mean genuine participatory communication. When children, adolescents, here we have formed an alliance for adolescents' participation in a process leading to a new constitution. And we are not trying to bring the voice of children. We are not going to be the intermediary. We actually have put children, adolescents, as a constituency in the governance of our alliance. They speak for themselves. We don't speak for them. And I think it's key because as I said, they're present, but as well their future is at stake here. So children are very much capable of articulating what they want and what they need. I'm not saying they should decide everything, but I say they should be partners in the decision making. And I remember again a nice experience I had when I was in India, where I met some of the children that were actually being received and informed like a local parliamentary constituency to present what were their needs. I think it's the right way to go. These strategic lines is something that are needed because communication is, as I say, it's key to push for a change. But we need to have all the other things in place. We need to have, to make sure that the policy environment of a country is conducive, and that's why we have the advocacy. We need to make sure that the institutions which are at work, institutions from ministries, line ministries, civil society organizations, and the like, are also supporting what needs to be done. And finally, we need to make sure that children are part of it. And, in an unequal society, the implication of such pandemic will lead to further increase in inequalities. And what worries me is the increase of violence for children. I've seen firsthand when I was living and working in India, for instance, the suffering of too many children, violence, social, psychological and physical violence, trafficking, child marriage. How much of all this would have been increased during the pandemic? We know that in Latin America, it has increased. We have already data. We don't have definite data, but all this of the violence is like a pandemic within a pandemic. So if there is something that we are learning from this pandemic is a need for dialogue as a way to take difficult decisions, assess the situation, and getting the needed support from the population and requires also children participation. And the deterioration of the socioeconomic environment in virtually all countries of the world are likely to hit harder the poorer and most vulnerable population, and among them, again, children will be disproportionately affected. That is why we need communication strategy helping to ensure that mitigating measures will be in place and by decision makers with the support of the public at large. Children cannot be the ones paying the bigger price for this pandemic. This is not only ethically and morally wrong, but will also have long-lasting consequences for the future of our world, or better, their world. Communication alone cannot avoid that the inequalities gap for children widens, but it is, if used strategically, communication can help reduce this gap. Thank you very much.
Thank you so much, Dr. Paulo. There were so many interesting and very hard-hitting facts, and also aspects in terms of social norms that you have highlighted. You have very strategically talked about how the simple action of closing schools due to the lockdown has affected children in so many ways. And one of the unintended harmful impacts of the entire COVID-19 pandemic is obesity in children and, of course, in adults as well. And at the same time, which is very contradictory but true, for many children coming from vulnerable strata of the society, their meals are affected. So it is extremely interesting to see the contrast and the inequities playing out so strikingly. Of course, you talked about the digital divide and how education has been affected, and how COVID-19 has surfaced again the inequalities out in our face. So with this, we also see quite a few questions here in the chat box, and we can take a couple of them. So the first question that I during such a pandemic. Would you like to, Dr. Paulo, would you like to take all the questions and answer them in one go, or would you like to go one by one?
Maybe one by one, but Dina, please don't call me Dr. Paulo. You know me, call me Paulo, please. And no, this question, I don't understand which kind of services are we talking though?
This is a question from Debashish. Okay. Debashish, would you like to unmute yourself and...
Dimensions are at least in place, so you have to make sure, and there we had many interventions when I was there, but one of the biggest mistakes as communication we made in the past is trying to push for behavior changes without having everything else in place. It's not possible to change. I mean, just to make a silly example, when we're promoting use of toilet in some places, and then we went and we found out there were no toilets available in schools, in places. So how can you push to change behavior when, for instance, the infrastructure is not there? So that's what I'm talking about. And I think it would be more effective start more at the district level rather than a national level, even though the national should be the overall framework with policies and related actions.
All right, thank you. We move on to the next question. The next question says, how to handle the vulnerable and poor children's status affected due to post-COVID-19? I think the question is basically how to handle the impact of COVID-19 even after we have had the vaccine, post-COVID-19 situation and its impacts on children.
Yeah, well, again, it's a difficult one, but I think what I'm trying to do also here, Chile is supposed to be an high-income country, but we have a lot of inequalities and we have a lot of challenges. And I think how to handle it would be not to handle everybody equally. It means focusing on most vulnerable children as a priority. Economic point of view, but from the emotional point of view, from an educational point of view, the effect of this pandemic is that inequalities will grow. And if we want to stop them or to reduce them, we have to start with children, and we have to start from the educational opportunities, because many children will already fallen out of school, and many of them will not return. So the answer for me would be to focus on the most vulnerable first.
All right, thank you. And we move on to the next question. This says participatory communication requires extended and sustained engagement with communities. How feasible is it? Number one, under emergency situations, and number two, when the governments and other development agencies in developing countries are hard pressed to attain targets and utilize budgets within definite time frame.
Okay, this question in two parts. The first is very difficult in an emergency situation where you cannot have physical contacts or proximity to do participatory exercise. Now, most of the things, depending on the situation, you do it virtually, but in many places in India, that might not be an option. So, in a way, you have to wait until the situation will allow that. The second part, I don't think having participatory activities and community engagement activity is actually a financial burden. I don't think you need money. You need time, but at times money it can also have an effect on the economic part. But the fact that by putting community engagement first, it might take some of your time, but it will save time and eventually money afterwards, because you're actually going to take decisions which are relevant to the community. So I would divide this in two. The emergency situation will not allow participatory approaches in many places in this moment, but when it is possible, having that, I think it's quite obtainable and will bring some long-term benefits.
Thank you. The next question that I see here asks, the policies such as teleclass, education through television, to provide education has actually resulted in counterproductive results such as increased dropout rate and child labor. So what could be the best policy measure to provide continuous education during the pandemic?
Yeah, I mean, education, it's a learning process. I am a big follower, and Vina and my team there knew it, on Paulo Freire, which said that the actual learning, it's a never-ending process, and it's a mutual process. And having teleclass, television, I don't see it something particularly effective. You might have some little spots, 5 minutes, but to learn, you need interaction. So, having said that, what are the best policy measures? Again, the policy would be easy to say you need to have classes in online mode and stuff, but then you have to say, if you have the infrastructure, all children have connectivity? Do all children have a tablet or a computer or a cell phone? They can follow those classes. So again, you have to make sure that all the elements are there. But the best, of course, is a presential mode. Second best is a virtual interactive mode. Teleclass or with mass media going to children is the least effective approach.
All right. I think last two questions, because I see questions trickling in one by one, but these are the last two questions that I think that we can take within the given time limit that we have. So the next question is, what are your views about mediated communication and participatory processes in the current context? This is the second last. I will come to the last question now. Yeah.
Wow, it's a very broad question. I mean, my views is that, again, participatory processes at the moment are very difficult to implement if you don't have the right infrastructure. In Chile, we have set up an alliance with children participation. We meet every 2 weeks, but most children here have connectivity and computers. In places where this is not the case, it's very difficult. I still think, that mediated communication, if it is interactive communication, is still the best way to do. Unfortunately, in this context, it's not always possible, and so there is not much we can do within this time frame.
All right, thank you. The last question. This is in a combination of comment and question. So this says the implication of COVID-19 will emerge as at a much later time than we can anticipate now. Marginalized communities who were left behind due to digital divide or compromising quality in education and professional training that are hands-on, like medicine and field laboratory based, are we taking steps to deal with this future catastrophe which seems inevitable?
Okay, thanks. And I will link this and the one afterwards by MD Safi, because are linked. As I said in my presentation, it's the consequences of this pandemic are most likely going to be higher inequality and some vulnerable populations falling back a lot and suffering a lot. Communication is not enough to reverse this trend. Yet communication is needed to try to prevent it, but unless there must be a change, a paradigmatic change in society, and not focusing only on growth, but focusing on redistribution, focusing on giving priorities to vulnerable segments. Children, I repeat, are among the most vulnerable all the time. After India, I worked in the two of the high-income countries in Latin America, which have quite low poverty rate. And yet, once you measure the children poverty rate, in both countries, they were the double of the adult ones. And it's a trend, it's a global trend. So what to do is, communication can help, but must be done through policy oriented to vulnerable populations, and for me to engage private sectors, religious organizations, academic centers, and civil society, all to work together to try to avoid this global catastrophe of people falling in extreme poverty. Thank you.
Thank you very much, Paulo. Thanks for being so patient in answering all the questions. I know we have had quite a few of them, and also with all the things that you have shared with us today, based on your experience of working in several countries across the globe. So, with that, I thank you from on the behalf of all the organizers, and of course from my side. I understand you might have to leave. However, we would be very happy if you continue to join us and be with us for longer.
Thank you. I will be on for another half an hour. Then, unfortunately, I have a meeting. I have to go. But I will be for half an hour on. Thank you.
No problem. No problem. So, moving on, now we have the privilege of having Professor Basu with us. So, yes. So, Professor Basu from Department of Journalism and Mass Communication, Banaras Hindu University, India. So, Professor Basu has a vast and long career in teaching and research in media and communication studies. He pursued his MA Communication and PhD from University of Philippines, Manila. He also holds MS, TV, radio and film degree from Syracuse University, New York, USA. He is currently serving in Banaras Hindu University as professor in the Department of Journalism and Mass Communication. He was involved in numerous projects, that is, the status of Hindi journalism in Hindi-speaking states of India, population communication, science communication, health communication, innovative project, UCG, New Delhi, etc. His work is known in the domain of communication research, films, planning, scripting, and producing radio, television, and multimedia programs. So this is what the team of students from Teshpur University has gathered about you from LinkedIn, which is also incredible as an exercise. I was thrilled when Anjuman told me about this. So Professor Basu, over to you. we now eagerly wait to hear from.
Thank you, Veena, and thank you all the participants. I have been eagerly listening for the last 2 days, and now it's my turn to say something. Well, my topic that I have chosen to speak on is mapping of communication responses of the Indian societies. I have put in plural because I think we do not have a monolithic kind of Indian society. We have societies within societies, sub-societies, and you can name it and you can go on mentioning that. Also, I would like to talk a little bit about MDG, Millennium Development Goal, because when I did that innovative project on health communication, we were in the middle of Millennium Development Goal, and then as the project was, I was winding up the project, then the Sustainable Development Goals came with 17 targets. So I will talk about that one. Also, the role of communication and media, particularly, and I would like to distinguish between the media and communication, because many times when we talk communication, we think about the mainstream media, and the whole vast of other strands are left out, and also the power play of communication, what goes on behind communication, and how much communication can do and cannot do. I agree with the previous speaker, Paulo, that communication can do that much when all other things are in place. Even this morning when I was taking class, I was saying that, in so many years after independence, India could not teach the whole nation to wash the hands before taking a meal. And still there, hand wash, it was in 19th century. The concept came, and the Lifebuoy soap with carbolic acid and all that. Still, hand wash is something that we need to campaign for. It has not come in our everyday habit, everyday life, that when we do anything, we need to wash, and now we need to particularly campaign for it. So I'll be using some slides because in the beginning I have some data to be presented, and I think if I put it in the slide, then it will be good to see and probably understand it more. So let us do that. Millennium Development Goals, out of 8 goals, we had 3 directly related to health. I have put also this one, the 4th one is eradicate extreme poverty and hunger. And I was going through internet and trying to find out what is our position in India, and I have found that 21.9% of our population suffers from that, and it is 286 million, staggering number. Almost 1/4 of our population suffer from that. Then the second point was reduced child mortality. India's position is that 30 out of 1,000 child die before they complete 1 year. And the state that I come from, it's Uttar Pradesh, where the number is even more. It's 41. And then the third one is improve maternal health. That was the target. India's position is 113, but the state that I come from is 197. Again, huge. Means, and these numbers, 113 for India is out of 1 lakh live birth. That means 113 women are lost in that. In the bracket, I have put that it is the institutional birth is 79%. That means 21% children are still born at home or somewhere else, not in hospital or health center. Now, the another health target or goal of MDG was combat HIV, AIDS, malaria, and India has 2.3 million AIDS patients, death 10,000 per year, malaria 15 million people, and 20,000 die of that. So, bleak picture indeed, and when you get this kind of picture after 15 years of working, sometimes it could be discouraging, but I'm sure the situation was much worse than this in the beginning, say in 2000, and by 20, this is the figures. These are the figures that I got in 2018. So we are there, but we need to still work on so that we can reduce the misery of our population. Then SDG comes, 17 goals. I have gone through it, and I feel that the last goal that talks about partnership and all is not a goal. It is actually encompassing the other 16 goals. And like MDG, SDG doesn't have that kind of a target, but it's not very concrete. So measurement at 2030 might be a little problematic. Then the next one that we talk about is before MDG and SDG. Actually, in 1980s there was a decade of water, and that decade of water, working for water availability, taking water to people, and there were many programs. The whole decade of 80s, the last century. Again, this year we have 2018 to 2028 decade of water, and always you will see the children are vulnerable, and many diseases come to them because of the lack of water. 90s was a decade of literacy. Actually, 1990 was the year of literacy and international year. And then we still have 331 million illiterates in India. Again, almost 1/4 of India's population is illiterate. Now, I was wondering as to why we have this kind of a situation. Say water, literacy, MMR, IMR, malaria, they have not probably become people's movement, like Chipko movement we had years back, where the people in the villages, the ordinary women, men, they were coming and protecting their trees in the Uttarakhand area, in the northern part, in the Himalayas, not allowing those trees to be lopped off. This was a people's movement, and probably we need that kind of push for water, for literacy, for MMR, for IMR, malaria, that it should become a people's movement. Actually, what happens is that the state always magnanimous, showing that they work for the people, and I think maybe people do not like someone working for them. They would like to do things with others. So we must change our focus from working for the people to working with the people. That's important, so that participation of the people will be more, and they would feel that this is their own project and not somebody else's. People's reaction to the recent crisis, we all know that overnight people became destitute, helpless, disempowered. Reaction mostly was out of fear of the unknown disease and fear of the state machinery, the police, the agents. So that was one reaction. So whatever they were doing out of fear and not thinking that they must do for their own good. The responsibility what was absent is that people were most vulnerable, and state could not reach there, the agents could not reach there. We have the ordinary people. The real response came from the ordinary people to help those who are vulnerable and at the age or completely marginalized. So I have three areas or three stories to tell, but I will tell it in 2-3 sentences. Saurav Handa, very near to Banaras, he had a small, eatery shop where he used to serve food mostly to the driver. And when this happened, so he thought that he had all the infrastructural facilities to cook food, and there were many people who were going hungry because there was nothing available to buy or to eat, and they did not have money, they did not have job. These were all construction workers or workers who were selling vegetables and this, that, and the other on the street. So he came around and went from house to house to collect anything, vegetables, money, and he would cook food, and in the evening he would distribute them, say by 7 o'clock or 8 o'clock, and he had co-workers. And day in and day out, he was doing that for almost 4 months. And this was something that really inspired me, and I felt that here was a person who was doing where the state could not reach. The other is the Muhim, is a small organization. One of my female students, after completing his course in the department, he was working, he set up an NGO, and then it is called Muhim. And actually he was working in the area of helping people to use sanitary napkin, helping young girls in the schools who were in the puberty age to make, sanitary napkin by themselves at home, because the buying would be quite costly. So he stepped in, and all the migrant workers who were passing through Banaras to Bihar and beyond, providing them some food, some water, some shelter. And the packet that she used to give was of 100 rupees. And that was a great work that he did. Nobody mentioned about either Saurabh Handa or about Muhim. The girl's name is Swati. And there is an organization called Kiran, a Swedish nun who runs, out of donation, a school where you have the differently able children, and she looks after them. It's a school. They go through syllabus, and I have visited that place several times. And she was, collecting money and giving food packages to the homes of these children. So that was another, incident or another work which nobody has mentioned, no media covered. But I think these are the things that could have been covered well. Now, I was thinking as to what media does or how people reacted was a reaction to several things. One was that the government or the state is very monarchical. Of course, I have this touch of Michel Foucault here, is that they are not answerable to anybody, and therefore they can do anything without taking into consideration how people will be after getting those diktats or those directions. That's one, and it happened in India. All of us, we know. The second thing is that the institutional, power. You have police, you have court, you have local authority. Their task is to maintain order, law, not to reduce the misery of the people. And here people were miserable. People were on the edge. People were going hungry. But those things, of course, provided, but with a lot of, power behind that. And the civilians who also took upon themselves self-imposed, self-chosen subservient, because they feared that huge state and the and the very strong machinery that they have. So a lot of coercion and fear went into it. Media, if we think of, and communication, and I would like to distinguish, media is one strand, the mainstream media is one strand of communication, plethora of communication platforms that we have. So it should not be, symbiotically used, that media is communication, communication is media. For me, its ownership is the key, the ideology, the philosophy of the media. Those are the guiding forces. And most of the time, the established mainstream media would go for their economic benefit and not so much of public good. But media is different than any other economic institution because it has one major standing. The cornerstone for its existence is the public good, and that they should not forget. But the current situation around the world, and particularly in India, that has receded to the back. And so what we find is say MDG or SDG or literacy, health, water, all these issues that we have talked about in the first part are not being really covered that way. They might be covering them by the way, but they really do not harp on it, not covering these issues very regularly. And yesterday I heard in this group, we were talking about fake news and the news that come in and divert people to areas that usually not true, beneficial. That seed of reportage, reporting events is something that innate of fake news. Because if there is an incident that is happening, there would be 10 reporters, and 10 reporters would be reporting the same issue in different way. Some would be, from their ideological perspective, some would be from what the media house would be dictating. And therefore, the issue that is covered is from the perspective of the ideology, perspective of the media house. And the empowerment that comes from seeing things differently is absent there. It's not there to empower people. Media is there to inform as they think should be informed the general public. Channel of communication are to be discovered. Now, as I was saying that the media that we have, we think that is all, and there is nothing beyond that. But there are, cultures, there are societies where broad media wouldn't work, but people communicate. People have their own network. People know how to get together and through communication. So they have their own network. Those are to be discovered, and if they are not fully matured, we need to help them to create that. And I think then we will have multiplicity of communication channel, not dictated by only technology and big media houses, but evolving from the society, from the grassroots level. People may say they don't exist, but for me, is culture is communication, and communication is culture. They would not exist if there was no communication among them. There lies, the issue of covering them, collating them, and communicating these small cultures, small communication efforts to the society at large. And yesterday or day before yesterday, I heard people were talking about Rogers' diffusion of innovation. I think diffusion of innovation as a theory is not so relevant here. What is relevant is the process. Roger was a professor of rural sociology. His book that has been mentioned, Diffusion of Innovation, is actually an analysis of 508 small and big studies. He collated them and analyzed them and came up with the book that is called Diffusion of Innovation and the theory in it. Now, how nice it would be if literacy, SDG, all these things could be, small efforts could be collected together and put together and communicated around so that people would have a choice, people would be encouraged to do something new, to do something that pays off. Remember that MDG and SDG, they are time bound, of course, but they do not end there. They continue. They will be with us, and therefore we must take encouragement from these small studies that can be carried out, collated, and published. Similar thing that we talk of is personal influence. Another book, Katz and Lazarsfeld, long back in 1952, they wrote. They also took up small studies like Decatur study, voting study, Almeida study of the political behavior of in the United States of America, and they found that media is not as powerful as it is thought to be, and therefore they collated all this, analyzed, and then they came up with a theory called personal influence, and from there two-step flow, multi-step flow of information. Those theories may not have value that much, but what I'm saying is that the process that these two books or these three authors have followed can still help us out to do new research in MDG, in water, in literacy, in SDG, and other areas that concern us. New media is something that people thought that would help us give voice to the voiceless, would have full control on our ideas and ideals. But we are robbed of that opportunity. People, of course, still have faith in Facebook, Google, and big platforms. But when we read and when we know what has happened with Cambridge Analytica and the elections in the US, not this one, but the previous one, Brexit and all, we know that once you step in there, in that arena, you are tracked and your personal information are collected and monetized. And your behavior later on are predicted, and many things you may not know about yourself, but these things would be, they would know, and accordingly they would put to you the messages, and they would predict your behavior. So what happens is that, and particularly in politics and in voting, voting is something that people feel empowered with. And if that is taken away or that is predicted very accurately, then I think we lose our privacy, freedom, individuality, and also our whole democratic setup will be in danger. And therefore, new media will have to be taken with a lot of salt. Now, top-down model, as we thought of for a long period of time, is not working, and we are now trying to come out of it. Top-down linear models, transmission models, they have not worked the way they should have. They benefited only those who are at the center of the power, and instead of helping the recipients, the people who initiate them, they feel gratified because they feel that they have done something. I think the stories of Saurabh Handa, Muhim, Kiran, they should form new strands and new communication culture that we would like to see tomorrow. One area that I feel that most of the communication that we are having is that we need to go back to the old order, pre-COVID-19 time. I think we need to think about it. Would we like to go back to the social structure that we had pre-COVID-19 time, or we would like to have a change, a dawn, maybe uncertain, maybe many things will not be there, but shouldn't we move forward with new hope, with less misery, and with more health for our people, those who are at the bottom, and those who know how to communicate, and they have their own way of communication, and help them to get empowered. If we do not see that one, then we would be mired in the politics of vaccine and vaccination, and big media's role to shout the poor man's misery will continue. I will end here, and I think I have covered my time. So thank you very much.
Thank you so much, Professor Basu. It was extremely insightful for all of us, the way you took us through the transition from MDGs, SDGs, and you presented the details based on data. You also talked about how the developmental issues of maternal mortality and infant mortality, including several others like malaria, etc., have not yet become people's movement. And that is why probably we are still struggling to ensure people's participation. And that is why the success is yet to be achieved in that area. I personally like the way you talked about the unsung COVID warriors, Saurabh, Muhim, and Kiran. So all in all, it was wonderful listening to you, and very insightful at the same time. I would like to sum up your presentation by quoting your own line where you said culture is communication and communication is culture. That is very beautifully put, and when we come to think about it in detail, we realize how true it is. So what we can do is that we can take up the questions related to Professor Basu's session along with the next speakers after the next speakers session, and together we can have both the speakers answer the questions which are being put in the chat box. If it is fine with everybody, I hope it is fine. Professor Basu, or would you like to take the questions right away?
It's all right, fine with me.
All right. So in that case, it is again my privilege to invite Professor Claudia Lago. So Professor Claudia Lago is professor in the School of Communication and Arts at the University of Sao Paulo, Brazil. At ECA, she is the chairperson of the Human Rights Commission and a member of the Now Kala Network, a collective of researchers and professors against gender violence in the institutional space. She has been a member at IAMCR since 2008, became the vice chair of the Journalism, Research and Education section in 2010, and chair of the section in 2016. Additionally, she was the administrative director from 2005 to 2009, and later president from 2013 to 2017 of the Brazilian Association of Journalism Researchers. And currently, she is an editor of SBPJOR's Journal Brazilian Journalism Research. She has extensive experience in management administration of entities and research groups, with a special focus on inclusion and construction of policies that take into account diversity, respect, and sensitivity to understand and deal with differences between groups. She has been researching non-fictional narratives, especially journalism, at their interfaces with gender studies, as well as research and action in media education. Professor Lago, again, your introduction has been collected by the team of students from Teshpur University. I hope we have been able to capture it in the way it would be desired. So again, very, very excited to hear from you, Professor Lago, and how interesting that we are getting to hear from so many experts from so many different countries, bringing in so many beautiful perspectives. So over to you, Professor Lago.
Thank you, Professor Vina. Thank you very much for the presentation, and thank you for the invitation to be part of this amazing webinar. And I'm learning a lot about the other presentations. And I will start to borrow some ideas from my colleagues, especially Professor Basu, saying that I will focus in a practical experience of communication that are presenting things differently, telling relevant stories to empower community, and try to create a culture to enable ordinary people and vulnerable people to engage in decision-making process that affects their lives. I think that my presentation, this is a summation of my presentation, and I will go to present to you what I am talking about. Let me put my, okay. I don't know if you are seeing. Okay.
Yes, we can see. Right.
So I have a lot to talk about. I try to maintain my time. I would like to talk about communication as a right and COVID-19 as a context. I would like to talk about what I'm talking when I'm saying about periphery, what is media in periphery, what's communication in periphery, what is the journalism making in periphery, new actors, new proposals, new support, and I will look at a specific experience, as I told, that is Agência Mural de Jornalismo da Periferia. I will look at what this agency is doing about COVID-19 and what is their perspectives and their dilemma, okay? So, talking about communication as human right. I agree with Professor Jan in the other day when he said that communication is or have to be another SDG, okay? Because communication is absolutely important to achieve all the GGs. Without communication, it's impossible, especially if we look to the four, that's quality education, gender equality, and reduce inequalities are totally linked to the necessity to make a very important and reliable and participatory communication. So, this time, I agree totally with Professor Basu when he said that there is media and there is communication, and these are different things, okay? So when we are talking about communication now, we have to look at people that weren't present before in the media system, and they are not present in the media system yet, but they are talking about themselves and to themselves, producing media, producing communication against mainstream media sometimes. different from mainstream media. And I will look at some experience of that, okay? But this experience is dealing with the pandemic. And as my colleagues pointed a lot, pandemic affect all of us in all ways, especially vulnerable people and people that are in informal jobs or that are not jobs, they don't have jobs, children, as pointed by Professor Paulo, and women, because the violence that Professor Paulo mentioned about children is a violence about women and children, because they are the group that suffer the violence of the restraint in the pandemic. So what we are dealing to is the spread of misinformation and fake news about the pandemic. And this is another pandemic in the pandemic. And it's very, very complicated and is something that attacks especially these vulnerable groups. In my country, for example, we have the problem of fake news spread by groups in general, and we have the misinformation spread by the government. So it's a chaos, totally chaos, if you think about what has happened with people. People doesn't know if it's necessary to do the isolation or what's happened about the vaccine. So it's really, really complicated and very hard to live in this context now. So, but what we have is that civil society reacts, as pointed by Professor Basu too. People take care of people if it's necessary and if state's not present. People take care. People try and build a lot of networks to do that. And in Brazil is the case. And civil society reacting, combating official and non-official misinformation and fake news, provide the scientific and the reliable information about the pandemic, and doing a lot of initiatives to meet vulnerable groups' needs. So, these are two photos. As a lot of countries in the world and in Latin America, we have two cities in one city. This is the health city. The health city, it's very beautiful, very green. And this is what we call the periphery, because it's the city around in the border of this health city and where live most part of the population and the most vulnerable population, okay? The periphery is an island of inequality, as a lot of countries. Depend heavily on informal economy, so they are very, very attacked by the pandemic, deal with precarious dealings. They have less access to public service, health service, or educational service. For example, in São Paulo, we have a lot of cities and another city in the city. Example, in a health neighborhood, the life average is 80 years old. In a peripheral neighbor, the life average is 57 years old. 23 years old of difference. The most shocking data that I see is the infant mortality in peripheral neighborhoods are 20 times more than health neighborhoods. So I think that is marks the opposition. Okay. The worst is these islands of inequality are framed by the media, the mainstream media, as about with two keys: poverty and criminality. This is a cover of a very large and important magazine in São Paulo, in Brazil. And I think that the cover is explain itself what is the frame of the media about the periphery. What the cover says: the siege by the periphery. Middle-class neighborhoods are being squeezed by a ring of poverty and criminality that grows 6 times faster than downtown areas of large Brazilian cities. These two words that I pointed, poverty and criminality, is what media see when look at the periphery. So periphery is only poverty and criminality. It's very, very hard way to frame the life of a lot of people. So as civil society reacts, the periphery reacts too. And since the beginning of the century, we have a phenomenon of a lot of young people from the periphery went to university because of the progressist programs to open the access to university. So these people went to university and take a lot of degrees, especially in journalism, in communication, and decide, because there is no job in the mainstream media, but not only because of that, they decide to make media in the periphery, about the periphery, trying to tell the relevant stories with other frames than poverty and criminality. They try to talk about the inequalities of the periphery, but looking at that inequality not as natural things, but things that have to be combated, that have to be fight against, have to have policies, public policies to mitigate the inequality. They start to change the communication in the periphery, especially talking from the point of view of the inhabitants of the periphery, and that's the difference. So they have the periphery as an identity thing. They are anchored in the territory of the periphery. They use that. They talk about the periphery as their place, their space. They produce collective work. They work in network system. They highlight diversity, especially race, class, and gender. And they produce several initiatives. And these initiatives are linked together. So I will look at some of this initiative that's very important, that is Agência Mural de Jornalismo da Periferia. This agency started in 2010 as a blog, became a site in 2015, and now they produce newsletters, podcasts, social media. I will show you who are they. So you can see this is some of the group, because they have a lot of combinations. They have people that are coordinating the groups, and they have a lot of young people that are collaborating in the group, more than 100 people that are collaborating in the group, occasionally or more in day basis, but they have a lot of people doing working in the process, in the project. And this I recall for their site, when they say that things that are very important. Periphery was excluded from high quality coverage or was poorly represented by media. So they intend to fill this gap. They are a new agents of information and intelligence about the periphery. And they consider SDG 10 an objective because they intend that they comprehend that to fight inequality and poverty, you have to use communication. So this they put in their sights. It's very important because I think that shows that they change the point of view. So I look at some special edition about COVID-19 that they produced since the beginning of the pandemic. It's already done. They are doing all the weeks, the days, they update the edition. But I look at this special edition, and what we find is there is more than 60 reports on COVID-19 informing about the pandemic for the peripheral populations. They point the inequalities of access to the public health system, asking for policies that protect the most vulnerable, and showing initiatives that are trying to fill the gap of the state about the most vulnerable people. They use to talk using periphery, the experience of people from the periphery to talk about, and they provide a lot of information that try to combat misinformation with some kind of accessible language. And they start to do a podcast to amplify the speech because they are online, so there are problems of access. So they make podcasts and they try to send the podcast by WhatsApp, for example, that to spread the idea between people in the periphery. In Brazil, we use WhatsApp very, very, very much. Okay. So this is a kind of report. This is a report that tries to fight against misinformation. This specifically is about vaccine. So the report is: are you waiting for vaccine? We can explain to you a lot of things about it. These are some reports that provide hints to deal with the pandemic and show service. For example, this one is about how to have free service of mental health in the pandemic to peripheral population. This is about what to do if you lost your income. So some hit, some place where to go, how to access the government system, so on. This is how to eat better in the pandemic, because pandemic is a problem about how we eat in the pandemic. This one is if you have to use public transportation, what you have to do. This is this is about if you have a little shop, what you can do if you have to close or only to use to deliver food, for example, what you have to do, who you can ask what to do. Okay. So a lot of very, very practical information for people that are engaged in this kind of work and shops and so on. They provide reports about support. So these are initiatives that are talking about where you can go if you need food, for example. These two are about food specifically. If you don't have food because of the pandemic, where can you go? This one is about where can you go if you need information, reliable information about the pandemic? This is another initiative made by the community. So the site visualize these initiatives to everybody. So, despite the fact that this is a very important, refreshing, and I think really new form to do journalism, to do communication in the community, I think that they face some dilemmas. And the first dilemma is the support. They don't sell media, they don't sell information. Everything are free, of course. So they need government sponsorship. And for example, in this moment, my country, the government is against all the popular initiatives. So they don't have government sponsorship anymore. And they are depending on foreign grants. What is okay, they are having some foreign grants, but it's an uncertainty. So the first dilemma of this kind of new production of media and journalism in periphery have to face this problem that is the support, how to support the initiative. In my point of view, they are still male-oriented, very still male-oriented. They look at gender intersectionality, but in the command positions, there are men. They are not white and old as the mainstream media. They are young, but they are men. And sometimes they don't know what to do about gender, and they don't have this kind of visibility. So I think that they are male-oriented yet. And the other important issue is that they have limited capillarity. So they talk about the periphery, from the periphery, but no all groups in the periphery are able to receive their communication, their information, their products. Because as we know, in periphery, we have a lot of gap of access, internet access, and a lot of gaps in all the practical access to everything. So this is something that limits the spread of the information that they are trying to do. But I think that they are working on that. They are doing a lot of other things that are not only communication, journalism. They think art. They are doing other products, trying to get attention of all the periphery. So it's what I have to present to you, and thank you again for your disposition to invite me, and I'm available to talk more about this experience if you are interested. So thank you very much.
Thanks a lot, Professor Lago. It was wonderful listening to you. And when I was hearing you talk about the periphery, I could relate it to the context of India, where we have geographically marginalized population groups. And you also beautifully talked about how young people from those groups came out and presented their problems after identifying it and brought it to the mainstream for it to be resolved through the participation of the communities where they come from, how they used technology and podcasts to amplify their concerns and voices. While talking about the limitations of the entire initiative, you also talked about gender, which is essential to communication. And unless we have representation from all the genders, the views still present themselves as skewed and are not balanced. So thank you for that. Now we will move to the questions. We have pending questions from the last session also. So I will try and take them all in one go. So a few of the questions are for Professor Basu and few of the questions are for Professor Lago. So beginning with one question from Sifar Nandi to Professor Basu. It says that reportage on discrimination linked to AFSPA in Northeast might not have been limelighted like its counterpart in Jammu and Kashmir, but it has still popped up once in a while in the mainstream media discourse. Can an argument be made in relevance to this, that sensationalism in the public discourse is more influential to media than the typical quid pro quo agenda media holds with politics? Slightly long. I hope that.
I'm trying to get it.
Yeah.
Well, yes, this AFSPA, no? AFSA, as we say. ASPA. Yeah. It has been there for a long time, but he's right that it is not being highlighted continuously so that opinion could be formed. And in many cases, I feel that we are depending on mainstream media, and I don't think that mainstream media would write about any state institution that could put them in poor light. So naturally, they wouldn't. What is needed at the grassroots level now should be, the campaigns and opinion should be formed, and then this should be put to the higher authorities so that this can be tackled. I mean, we need to look for alternative media. The mainstream media wouldn't help.
Thank you very much, Professor Basu. The next question that I see here is from Lakshmi Pathak, and it says, what is the role of developed countries to reduce such violence of poverty and criminality in developing countries? Looking at the time when the question has been posed, it looks like it is for Professor Lago.
Sorry, I'm trying to look at the question.
What is the role of developed countries to reduce such violence of poverty and criminality in developing countries? In fact, I think it is open to both the speakers. Anybody can address this.
I think Professor Lago can take it first.
I don't know if I understand totally the question. The role of communication of the role of developed countries to reduce such violence of poverty in developing countries. Oh, okay. Oh, I think that the inequality is a global thing. And the inequality is because we have developed countries and in developing countries. I think that the two are linked. And I don't know if developed countries are able or fully interested in fight against poverty in developed country. I don't know if it's something that we have to take for granted. I hope I can. This is my opinion. So.
All right. So shall we move on to the next question? So the next question reads, all the different service providers have their defined role to ensure child rights issues. My questions are, what should be the model of communication among the different departments to ensure childhood of the most vulnerable groups? What will be the communication strategy to bring back vulnerable communities in their normal life as it was pre-COVID pandemic period? I think this is a general question, could be answered by any of the two speakers.
Is it the Department of Journalism or Mass Communication or the...
I understand the person is talking about government departments.
Okay. Yeah. Well, in that case, the people in general at the bottom, they don't have that. They don't have power, and I was telling that the power is to be not snatched in the sense that red way, but I think we must the people should organize themselves and put forth there is a resolution that these are to be addressed. Policies are to be formulated so that the violence against children can be stemmed, can be reduced. The miseries could be reduced. I think children are to be protected. They are the most vulnerable. They are vulnerable at home. They are vulnerable on the street. They are vulnerable in schools. We know all the stories that come. So only law will not do. A kind of awareness should come, and people must get together and help each other. That's the only way. One thing that we must do is, no matter how weak we are, we must know how to resist. We must know how to raise our voice. These two things, resistance must come, no matter how feeble, how weak that resistance is. You may be mowed over, but resist we must.
Oh, I agree with Professor Basu, and I would like to add that I think that there is no formula about how to communicate. I think that the only thing that is necessary and is always the same is we have to listen these populations. We have to listen these groups to form our strategies, because without that, they will be not effective.
Thank you, Professor Basu and Professor Lago. Moving on to the next question, it says, it's a great presentation. I wish to know, is the periphery the island of inequality, or is it the island of equality and the product of inequality in the larger society? As all or most of them in the periphery are suffering from poverty, oppression, lack of proper policy implementation, and mainstream media dark zone. This is clearly to Professor Lago. So, Professor Lago.
Yeah. Yes, and yes, I think that you are right. It's a metaphor, but it's not a very, very good metaphor, because you are right. It's not an island of inequality. It's it's island something. I don't know, it's equality too, because there is inequalities in the inequality, but it's produced by the inequality in the broad society. So I think that you're totally right.
Mm-hmm. All right, so moving on to the next question. This is to Dr. Basu. It says, the political parties and corporate entities exploit the possibilities of new media through the customization of feeds and messages to cultivate and nurture thoughts and to reap profit, as per the revelations of Christopher Weiland, while the organizations like UN are hesitant to use the same strategy to bring in positive change.
I think Dr. Paulo will be the best person, because he works with the United Nations. But I think what this Devdas is hinting at is that new media has got tremendous power to penetrate various layers of the society. I think that that is something that we need to master. We need to but whether we will be able to do that, whether we have enough of courage to do something that would go against the mainstreaming, against the mainstream thought, I really do not know. But institutions and organizations like United Nations should be able to do. And Dr. Veena, you are in a position, you are with UN, you should be able to assure them that yes, it can be done.
So yes, in addition to what Professor Basu just mentioned, I would just like to bring in a perspective, not that it is happening, but artificial intelligence. I understand this question also has an element of that without explicitly mentioning it. So yes, artificial intelligence, which is being employed in various social media platforms, and being used by various social media leaders, like Facebook is used, forming opinions about the people who are contesting elections in various countries. So artificial intelligence, of course, can be used in positive and negative ways both, and it has the potential to be used in the area of social and behavior change communication also, the subject that we are talking about today. However, we are in a very nascent phase, and it is just at the thinking stage. As of now, nothing concrete has happened. So yeah, this is what I would add in addition to what Professor Basu has already said in his answer to this. Now moving on to the next question. In the initial part of the pandemic in Brazil, Jair Bolsonaro was in disagreement with the state governors on the strategy to handle COVID. How did this impact the communication strategies for mitigation of the crisis? This is the first question. I think, let's look at it and then we'll move on to the next question from the same person.
I will respond to two and link it because they are linked.
So I'll also read out the next question. It says, as per some media reports, mostly BBC, there were substantially higher number of COVID cases and fatalities among the indigenous Amazonian communities. Was there a failure to implement community-specific communication strategies with reference to COVID crisis?
Okay. I don't want to do another conference about what's happening in Brazil. It's very difficult because we have a negationist government. So he yet is in conflict with the governors. Now it's about the vaccine. Okay. He is saying that vaccine is not good, vaccine can be damage people. So you can imagine that to live in Brazil in the pandemic with the government that we have in federal terms is being stressful, to say the minimum. It's been very, very stressful because all the misinformation came from the government. So it's very, very difficult to deal with that. You don't have a strategy of communication that can block this kind of thing, okay? What civil society is trying to do is spread good and reliable information in all the channels possible. But it's amazing because we are talking about the vaccine and we receive a fake news that is about the problem of the DNA with people that will use the vaccine. We are talking about need to do social isolation, and the government say, no, that's bullshit. It's not necessary to do that. You will have the pandemic, but it will be a flu, a little flu. So it's there is no strategy possible to deal with that. What we are doing is we are dealing, okay, we are trying to mitigate this kind of misinformation, but it's very difficult and is affect especially vulnerable groups that depends on the government, depends on the public health, depends on all the initiatives that are put together by the government. And we are looking at a lack of state because of that, because of this political, ideological proceeds of Brazil's government. And the second question is about that too. It's not only a problem of information with some populations, indigenous or vulnerable populations. It's problem of care. The problem is effective care. People are having no care. So that's the problem. And it's very difficult to explain what is to live in Brazil now with these combined things, the government and the pandemic. It's not for beginners. Okay.
Thank you, Professor Lago. Now we move, and these are the last two questions for the speakers, and with that we would be kind of concluding the session. The second last question says, then what role does the privileged upper caste class hold in the fight for equality or development for the unprivileged lower caste class? How can they address the problems without hijacking their movements? This is the first question.
I think Professor Basu can answer this. Professor Basu can answer this.
You want me to answer? You see, when society is organized in a very hierarchical way, the people who sit at the top, they are few, and they would like to have the bottom of the pyramid as strong as possible. That means underprivileged people at the bottom much more than at the top. Do you think that they are going to break the base or weaken the base? That would never come. What needs to be done is a kind of a movement. As I was telling, I would repeat that resistance, putting forth the resolve of the poor, the destitute, and the lowly. And that awareness should come. So they must organize, bring in awareness that they are being exploited to the full. Give you one example. In India, we have 440 million people, almost 1/3. They don't own even 1 inch of land. It is their country. And they don't have access to 1 inch of land. So, that kind of deprivation. Now, whether they are going to look for food or whether they are going to look for their shelter is difficult for them to organize and fight. But nonetheless, they will have to organize and move forward because the top people will not do it, at least unless and until they become Messiah kind of person that they would give up their wealth. It doesn't happen.
Absolutely. Thank you, Professor Basu. Now, the last question is clearly directed to you. It says, how one can protect oneself from being influenced by propaganda messages of media?
Well, one is questioning mind. Whatever is given in media, we should be able to, we must learn how to read what comes out from media. And that media literacy should be introduced at the school level so that they will be able to question, one-sided messages, then why the other side is not coming. These are the things, that means we must tell at home in schools, in colleges, as to how to scrutinize what the content of media. That should be a culture. It doesn't come all of a sudden that you say that, oh, this is propaganda and this is not propaganda. We must know that whether whatever they are saying, the content is being supported by evidence, or it's just that they are saying. So there are these things that questioning mind, whatever comes out, should be scrutinized by the people. Only then you will be knowing that this is propaganda and this is not propaganda. It takes time. It requires a kind of a culture. It also requires, the people in general, say in institutions like, say, schools, like colleges, like in the family, that we must teach our children how to question, how not to accept whatever is being given, even though he or she may be very powerful. But we must scrutinize that, whether this is. And that's how, the basic of philosophy is that we must question, scrutinize, and then accept.
Thank you, Professor Basu. So it is 7:37 p.m. in India, and I think all of us are looking forward to our dinners, preparing and then eating. So it's time that we sum up today's session. It was wonderful hearing from the authorities themselves. First, we heard from Dr. Paulo, who talked about how social and behavior change communication is playing a proactive role in mitigating the effects of COVID-19 pandemic on children. Then we heard from Professor Basu talking about the responses of the different societies in India to COVID-19 pandemic and mapping out the communication aspects from therein. Then, of course, we heard from Professor Lago talking about the narratives produced by alternative and activist journalism. So it was, in one word, if I have to describe the experience of listening to all the speakers today, it was extremely, extremely informative and enriching. Also, we saw wonderful participation from the participants here. I saw that we had around 135 people joining on Google Meet, and many others were there on Facebook Live and YouTube, watching us, listening to the experts talking here. So overall, my experience as a moderator has been a great learning experience today, and I would like to conclude, and I would also like to thank the organizers, especially the team. Professor Behra is here. He is like the guiding light for the Mass Communication and Journalism Department, has really mentored, and in fact, I was also fortunate to have got a chance to work with him directly and authority in the subject. Then Professor Joya, who is heading the department at present, she has always been very, very excited about doing new things, and this webinar, of course, is a step which must be initially looking like a thing which is full of risk, but she has managed to. Today is the third day, and it's going really well. So congratulations. Anjuman has been coordinating it wonderfully. My colleagues from UNICEF Assam, they have, of course, been part of the entire thinking process, and of course, they have also played a good role in organizing the whole thing. So I again thank the organizers for having all of us together here at one platform. This is good for me to go a long way, at least a couple of months, with the kind of information that I have gathered today, because there are very little opportunities like these where people from the communication arena come together and exchange their thoughts and be here and learn good practices in the area of communication. So it's unique and wonderful. Now I will just conclude with again a line that I had written. We all know that COVID-19 pandemic has made us witness many situations which are kind of the first of their kind, and stigma and discrimination for me personally has been one such experience. I work in the area of communication for development, and I had been designing initiatives to address stigma and discrimination through communication. But when me and my entire family got COVID positive, we also, living in an educated and well-to-do society, indirectly faced situations like that, and that was, to say the least, very demotivating. But at the same time, we also met some wonderful people who extended care and supported us both mentally and in terms of providing support to keep us well fed, and helped us recover. So when I was in quarantine, I had just written a couple of lines dedicated to the group, the volunteer group, which really stood by us. And the name of that group is Akshay Patra. In English, it means the inexhaustible vessel, the vessel which never gets exhausted. It is always full. So they were giving us home cooked food every day, all the meals. That was wonderful because everybody in my family was unwell. Was there to cook. So the lines that I had written, they go like this. The gesture brought back my faith in compassion, kindness, humanity, love, solidarity, etc. The group of angels call themselves Akshay Patra. When we face days which are full of despair, we must believe that the angel would spot us and extend care. For love spreads faster than the speed at which the evil virus can grow. When in doubt, just let yourself know that self-love is the most important and rest will follow. Mind is vagabond, the thoughts might aimlessly flow. But don't forget to remember, take it slow. So these are some of the positive lines with which I would like to conclude today's session. And I would like to hand it over to Anjuman so that she can make her Thank you, everybody.
Thank you so much, Veena, for so beautifully summing up this session. And it was indeed such an enriching session that we had today. It's absolutely amazing that what we've heard today, I think these words are really going to ring, in our hearts and our minds for a long time now, communication for all, empowerment communication, communication at the periphery, by those at the periphery, the marginalized. And it is this that we must all put in all our energies towards, so that we can empower the voices of the voiceless, help people who do not have a voice to articulate. And that is the only way in which communication for all can become a reality. Thank you so much to all our speakers today, Dr. Paulo, Professor Claudia, Professor Basu. Thank you so much for your insightful deliberations. Thanks a lot to the audience for their very, very enthusiastic participation. We are it's the third day today, and the response has been overwhelming. It has, never gone down a bit. The energy is amazing. Thanks a lot to everyone. Thanks, Veena, once again, and to everyone who has been really working in front and behind the scenes to make this possible. Tomorrow is our finale day, and tomorrow we would, I think Behra sir wants to say something. Professor Behra? Okay. I think he lost his connection. So would you like to say something?
Yeah, just one thing.
Yes.
Actually, I am really grateful to Sister Claudia and Veena, Paulo also, one thing I want to mention here, it is because of the speakers like David and John and Sanjay yesterday, and today Sisir, Claudia and Paulo, and the moderators like Sanjeev and Veena. We are getting a very good response from the participants. Let me tell you, when we started on the first day, we had this option of we never knew that this is limited to 100, and it reached 100. But people had to join through Facebook and also YouTube. And YouTube viewership was around 200, Facebook was around 1100. So what Jaya and Anjuman thought that we must take an app which gives us more participants where they can participate. And we did take another app where 250 participants are allowed, and it keeps on growing day. And 40. So it's all because of the speakers like Basu, Claudia, and Paulo, Sanjay, David, and also John. And Veena, thank you very much again for your nice summing up. And we want you to guide us, even if you are there in Bengal, you are a part of this department. And so keep guiding us, keep helping us. Sisir, thank you. And thank you very much. And see you all tomorrow. I hope you all will log in tomorrow. Thank you.
Certainly.
Thank you, sir, for adding in here. We believe that all the who have been part of these sessions during the last 3 days and would be joining us tomorrow. This is not the only occasion on which we would be listening to them. I believe we're going to forge long-term partnerships and collaborations whereby we can have more such opportunities to work together and bring in more such productive opportunities. So I hope we will continue to remain in touch, and just like Professor Basu has been with us for so long, we would have similar connections with everyone. Yes, of course, Veena, as I said, we started with a professional relationship. We ended up becoming great friends and family. So I hope we can do this. We can forge such relationships with everyone, and not just speakers, but also the participants. We will, love to hear from you all beyond this webinar. This is just an opportunity for us to connect to each other. So I hope we can reconnect on various other occasions. And I will just introduce what we're going to do tomorrow. So tomorrow we begin at 11 a.m. Indian Standard Time, and we have two presentations tomorrow. One on risk communication in a pandemic by Professor Rohan Samarjiva and Ms. Ramati Bandarnaike of Lenasia, Sri Lanka. And another on radical democracy, socialist politics and pandemic response by Professor Mohan J. Datta from Massey University, New Zealand. So I believe everyone who is, yes, I reiterate, it is 11 a.m. tomorrow. So we've been meeting in the evening for the last 3 days. This time it's going to be morning. So I hope you will all rejoin us tomorrow again, and we can indeed have a grand finale to this webinar. So thank you so much again for joining, and do fill in the feedback form if you haven't already. Thanks a lot to everyone. So
Calculating what they want and what they need.